So, today I'm mad as a box of frogs. Why am I mad as a box of frogs? Well, £56 billion was set aside by the NHS to defend cases against doctors. That's half the budget of the NHS. 50% of the budget goes on defending cases. They put aside a quarter of it in the year before that, so 26 billion was the year before. What is interesting is, in fact, the number of claims has declined, but what has increased by upwards of 40% are the legal costs associated with defending those cases. And it's important to note that a lot of these cases are settled out of court because it's commercially viable to settle them out of court. In other words, the cost of defending a case is higher than the cost of rolling over and giving in and giving money. Now, if there is fault, I will certainly be the first to suggest that there needs to be a fair and reasonable judgment and any doctor, nurse or healthcare needs to be accountable. But it seems that money is the new compensation. What's that about? Britain leads the world in compensation costs. It costs us more than any country in the world in terms of legal costs to defend these cases. Some surgeons pay over £80,000 a year in insurance out of their own pocket. And included in that is an excess fee, which can be £70,000 to £80,000 as well. So any case that comes through can cost that doctor, out of his or her own pocket, £160,000 to defend. Remember, if you're thinking of taking one of these cases to court as well, that the lawyers invariably get more money than the claimant. For example, having researched one lawyer on the internet, he brags about the fact that he's got £13 million for this case and £9 million for that one, and isn't he a wonderful guy for defending these poor people that get injured in cases. But what they don't tell you are things like after the event insurance, ATE insurance. After the event insurance is insurance that a lawyer can take out to protect them if they lose the case. So if they lose the case, they still get paid. Again, is that fair? I don't think so. So when you see such companies such as the ubiquitous injury lawyers for you, that's really classy, that one, isn't it? Yeah, you know the kind of clients they're aiming at. It's really injury lawyers for themselves. There's also Britain's biggest clinical negligence company who were bragging on the newspapers the other year that they have actually built £29 million from the NHS. And they think that's a success, that their fees have been £29 million. That's 1,000 nurses, more than 1,000 nurses in terms of costs. So, a note to those lawyers that do this. I go to work every day, as does every other healthcare worker, wanting to do a good job. We are ethically and morally bound by the fact we will do a good job. It's in the Hippocratic Oath, it's in everything that we believe. I can look at myself fair and square in the mirror and know that I'm a caring professional with good ethics and morals, and I would ask any lawyer that's involved in these clinical negligence cases, can you look me square in the eye and say the same thing and tell me that your first concern is for the patient and not for the money that is going to come your way? Unfortunately, I think I know the true response. And in closing, I would say to you all out there that when the call for money for the NHS comes out, remember that half the total budget has been set aside to give to lawyers. So when your son, daughter, husband, wife, grandfather is looking for care and it's not available because there's no money, you know where it's all going. And that, to me, is a real, true, national disgrace.